If you guys are not careful, they will own hospital, hospice, home health, doctor's office, medication, insurances.
Mr. Joyner, you are the CEO of CVS Health, correct? CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health Medical Clinics, correct?
Yes, it does.
CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the U.S. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. We're talking about 1,000% markups on medications for cancer and HIV. I think corporate monopolies are a problem. And this vertical integration, 100 years ago, we had this type of market concentration in our banks. And we did something about it when it crashed the economy. And we passed the Glass-Steagall Act. We should be considering that in our healthcare system.
Agree 100%. I think that that's where we are right now. But just to dig into what we're talking about, CVS Health, for those who don't know, they have 9,000 locations. This is probably one of the biggest retail/pharmacies, brick and mortars we have. Not if it's one of the biggest we have in specifically America. You pretty much see one on every major street. They do all types of pharmacy, whatever you are being sent, you can go pick it up from there. Chronic illness, chronic medication, specialty medications, they do that. They also do delivery medications, which for a lot of our seniors, I actually love that part. Then it gets interesting, the Minute clinics and the Oak Street Health clinics, specifically for Medicare patients, what does that look like? And is that ecosystem, does it work? And we were talking earlier today, and a point that was brought up is if you go to Oak Street Health, you need a medication, they write you an order from that medication, do they just automatically send that to CVS? That's the question she should have asked, right? That is the real question, because I can tell you as a hospice owner, when I go to a hospital and I try to get a patient that's in the hospital will be sent to another hospice company, right? They don't tell them, hey, there are other options out there. That's where I have a problem with the healthcare system. That in its very sense is where it's like, it drives me freaking insane. And it's like, we're here to help people. Even if this company is not the best or not most convenient for you, you shouldn't have to go there. So if you're saying, well, you don't have to go there, right? That's what the CEO would tell me. That might be true. But if you don't tell them there's another option, or hey, we can send this to a Walgreens that's 2 minutes down the street, you still aren't really giving them choices. And if you take away our healthcare choices long term, I'm not comfortable with that, because I'm seeing firsthand